the Chinese oversaying is, I think, a false argument. I think to make the argument that the Chinese, if you say it's because the Chinese oversaying, what you're basically implying is that Chinese households save a lot of money because their consumption is being repressed, as we talked about, and because of industrial policies in China that take money away from households and direct it towards enterprises. And as a result, you have this imbalance in the economy created domestically by government intervention, which then creates a surplus of savings, which then results in the external imbalances and then results in more exports and not enough imports. And then through the foreign exchange earned through that and the reserves, those reserves are then placed in the US, and then the US financial system, because it's so adaptable, just absorbs it all. That's the savings argument. And that doesn't really make much sense. Well, it would, if you're a pure sort of neoclassical, neoliberal economist, you might agree with that. But it doesn't make too much sense theoretically in my mind, because I would more adopt a Keynesian perspective, which is basically, it's the other way around. It's you have financialization and the increase through finance of demand in the US that drives the imbalances and creates demand in those countries that are supplying the US with goods. And I think that's much more what's behind the story of what's driving the imbalances. And that argument actually makes a lot of sense in terms of, if we look at the chronology, the US deficit takes off well before the Chinese surpluses start to take off. And it's really like, when you look at the data, when you look at the historical trends, the savings argument is a bit like putting the cart in front of the horse. If you look at just a simple time series of data, it's very clearly that the savings cart is behind the horse. Okay. Now you have this enormous demand coming out of the US that's driving huge levels of investment in China. And as a result, savings in China adjust to that. Not just household savings, because household savings have actually been falling as a proportion of GDP, or as a proportion of total household income. But it's the source of savings are coming from foreign investment, from the banking, from loans from the banking sector, from government subsidies, and also from retained earnings and enterprises that reinvesting their own earnings. I think China is actually practicing a combination between this export orientation, which is based on that model, to finance an internal, what we would call import substitution industrialization type of model, which is basically trying to build up nationally owned firms, supplying largely to the domestic market, but also to the foreign market. That might be slightly less profitable, but that creates a lot more value for the local economy and also has a lot more in-house technological upgrading. Within that domestic sector, within that more the huge domestic economy, wages are going up. And the government is actually trying to implement wage increases, and it's part of the reason why average incomes, average household consumption is actually rising quite rapidly, is because the government is, say for all sorts of categories of salaried employment, they're having 15-20% salary increases each year for the last 5 or 6 years, or 10 years even. So the government has had a policy of trying to increase salaries. Now the problem is that they're not necessarily increasing wages of the actual workers in the manufacturing sector. But there are some signs that wages have been increasing or possibly not, or it's unclear exactly what's going on. You can't always trust the financial press when it reports these things. But I think the key thing there is that China is obviously caught into a classic conundrum of export-dependent economies, which is that when you're an export-dependent economy, particularly when your exports are largely based on your main competitive factor is low-skilled labor, basically you're competing in the world with a combination of the cost of your labor and perhaps the productivity of the labor in terms of how much it can pump out in terms of scale economies and so on, not productivity in terms of technological know-how necessarily. And so what happens in those circumstances is there's a strong pressure to keep wages down. Because wages are not important to generating domestic demand. And the classic Fordist model was the worker had a high enough salary to be able to buy the cars he was producing, right? Yes. And that link is cut in export-dependent economies. So I think the export sector in China has the strong incentive to keep wages down, essentially. The domestic economy in China has the incentive to raise wages. The Communist Party also has the incentive to try and raise wages. So I think there's a political economy conflict there that's not easily resolved. Health insurance is a key political battleground in China, a decisive battleground in China. And we hear a lot about health efforts to introduce reforms in the health sector, basically health insurance for the population, moving towards a more universalistic model, which is a positive direction, but they're just taking small steps towards that goal, and they haven't gotten close to it yet. The problem, of course, is that I think similar to India, healthcare is probably one of the primary factors in terms of causing people to fall into poverty in China. They have the saying in China, you're fine as long as you don't fall sick. If you fall sick and you can't work. So it's the key to addressing inequality, I think, is in terms of moving towards universalistic forms of social policy, basically in health and education and pensions and so on, and having an integrated system across the rural and urban areas so that migrants from rural areas can still have their health insurance and education in the urban area. That's a critical key factor, because if you don't have that, the whole thing falls apart. The Prime Minister, Wen Jiabao, for instance, I think it was in 2004, 2004, publicly acknowledged in a public speech that all of the attempts at reforming the healthcare system in China since 1998 had been more or less a failure, and that they had to start from scratch again and really seriously think on how to do it. So they've been struggling with it, and they're aware of the problem, and they're willing to face it, and I think there's a significant faction within the Communist Party that see this as the primary goal, along with other types of social policy reforms, if China is to move away from the precipice. I think if they don't, and if they keep going on this path of rising inequalities, I don't see how the model cannot but exhaust itself in, say, the next 5 or 10 years. If they start reaching middle, upper range of Latin American types of inequalities, I don't see how they can. I don't see how they can sustain this model. The problem is that there's a sort of modernization mentality of we just have to keep growing, and eventually, because we're following the Kuznets curve, we're going to become less unequal, just naturally as a pattern of the way the economy changes through development. I don't believe in that theory, and I don't think it works, because I think even if you study historical patterns in Europe or the US, inequality only starts to come down through very intentional public policy. It doesn't come down through some natural process of development, right? Even Kuznets himself argued that. So I think as in India, I think in China, it's that point has to be made, that you won't solve the inequality problem by simply continuing to drive forward without actually, with it's like a fatalistic developmental attitude, you know? It's as if we've forgotten the history of the past, and all we know of the history of the past is that somehow they drove forward and inequalities naturally resolved themselves. That's not the way it happened in the past. The inequalities were resolved through major labor movements. Inequalities were resolved through major efforts to bring in universal health care and education and so on, through progressive taxation, through redistributed public spending, and all of these issues. And they will only be resolved in China and in India and in Latin America through similar types of policies, adapted to each context, but basically policies that are doing fundamental redistribution rather than just dealing with the symptoms. And so I think, for me, that's really the key challenge of China now. I hope that they're choosing the right direction, because I think if they do, I think they could become a real exemplary model for other developing countries. But not until they've dealt with that issue, I don't think they've become an exemplary model.